dead biological tissue that gets shed down instead of up.
We got you.
And what?
I said I got it. Yeah, 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 yeah. I mean, that's an
Cement
interesting
in the lungs. Pouring cement into the lungs.
pouring cement into the lungs. So now, what would fight that off?
So a person has an immune system that's a gift from God that is designed to push away external threats.
Right.
So that's why in most cases, people will recover because their immune systems are able to overcome the viral infection before the viral infection kills the lung.
So once you get to the stage, though, of being in the ICU and
Not so
being
good.
intubated, so this war, this battle is going on. What you're telling me is you win that only about 50% of the times.
Yeah, and even then you're scarred for life.
So no matter what, you're going to be left with very, very weakened lungs,
Correct.
damaged lungs.
Correct.
What percentage of your cases that you treated with hydroxy and let's call it Z-Pack, what percentage of your patients ended up in that condition?
0.
How many patients have you treated so far?
Hundreds.
Hundreds? Can you make it 200s, 300s, 400s?
By now it's closer to 5 to 600. I lost count.
5 to 600 patients. Were you originally testing them?
I was.
And what kind of rate of positive were you coming up with?
59%.
59%? So then you switched to you were going to treat the symptoms irregardless of what the test said. Is
Well,
that right?
the problem was the test took 3 days to get back.
And that could be, particularly for a very, very difficult case, that could be a critical 3 days, right?
Yeah, that's the main point, that we need to hit hard. We need to hit this infection hard and early.
And the earlier you hit it, the better the success, even for a compromised person?
Especially in a compromised person.
My understanding is that a compromised person, it comes on faster and stronger.
Right.
So that first 2 or 3 days is much more critical for let's say an elderly person or an immunocompromised person. Is that right?
That's very right. Let me explain. There's a high-risk group. The high-risk group, statistically, are patients above the age of 60, patients that have chronic medical conditions and or are immunosuppressed. There's depending on which country you look at, there's between a 6 to 10% death rate.
Among that group?
Correct.
So when did you first begin the hydroxy Z-Pack therapy? And how much hydroxy do you give them and how much Z-Pack?
So no, first what I did was I did 2 things. I blended the 2 treatments from South Korea and France and made a 3-drug regimen.
Okay, and what was that?
Hydroxychloroquine, which was the common denominator by both treatments. Then I used zinc, and then I used azithromycin.
Azithromycin?
Yeah, you know that azithromax or Z-Pack.
Yeah. So you basically were taking all 3 that had been used and
Yes.
and putting them together. So how much what milligrams of hydroxy?
I'll tell you my protocol in a minute, but would you be interested for the rationale behind the treatment?
Oh, of course I would.
So it's well known that zinc.
Doctor, I have to say, you should be a professor. You're a very good teacher. Obviously, you're a good doctor, but you're explaining this in a way in which I have to say, with all due respect, very few doctors could explain it as clearly as you are.
Thank you, Mr.
So
Mayor.
that's one of your gifts. You should know that, and thank you.
Thank you. I really, the truth is, I could have been a professor, but I really enjoy being on the front lines and clinical medicine.
I can see that. I can see that. So tell me the rationale for the hydroxy, the zinc, and the erythromycin.
Okay, so like we said before, the virus gets inside the cell and begins to hijack the cell's industrial complex. You know, its machinery. It's well known that zinc interrupts that.
Okay.
You probably heard of people who have colds, they take zinc Zinc
I
lozenge?
have. Recently, I had a cold, I mean, like 3 months ago, and for the first time, I took zinc, and I found it very helpful.
Right. So the concept is that it interferes. It throws a monkey wrench into the replication of the virus.
Okay.
So, but the problem with zinc is that it does not get inside the cell very easily because there's a biochemical reason for it. Not that important right now, but
So it has a hard time getting in. If you just take the zinc, only some of it is going to get in, not all of it, right?
a very small percentage.
Very small percentage. Okay.
Now, what's interesting is hydroxychloroquine is a ionophore. That's a fancy word for a channel, a canal that opens the door and allows the zinc to go from outside the cell to inside the cell.
So it opens the door for itself, and in doing that, the zinc can come in also.
No, it is the canal.
It is the canal.
It's the key that opens the canal. Think of the Panama Canal, and you have
But
to open
it's also its own medicine, right?
yeah, but that's how it works.
Yes, I got it. Okay, so it opens the canal, and then the zinc, then that facilitates the zinc coming in.
Right,
So then you get the real benefit of the zinc.
right.
Wow.
That's
Well, how did you
yeah.
figure that out?
I did the research. I looked at the studies. I was curious how things work. I like to put puzzles together. So
Oh, God bless you. And then, so now tell me the theory of the erythromycin, the Z-Pack.
well, we don't know, but I have my theory, which is that when you have a severe viral infections, it's well known that you can get a secondary bacterial secondary infection. So I believe the Zithromax is there as a precaution, and if there begins a bacterial process, it
Market data
kills it
connection
before
lost.
it causes a bigger problem.
But it doesn't actually specifically deal with the COVID-19.
Not enough data to answer that.
But it could. It could.
I don't think so, but
Oh, you don't think so? I mean, some doctors have thought that
it's an antibiotic in concept. So,
I know, and it would not make sense, but
but we don't know. But it seems to work. So as long as it works, that's all I care about for now.
okay. So now, just give us a sort of overview. What's the situation in the community now? Now, how long have you been treating this?
Since last Tuesday.
You began treating it last Tuesday.
Yes.
So, you've treated hundreds.
Yes.
You've had. Oh, give me the results. They're your results. You should be the one to put them out. What are your results, doctor?
And I'm about to publish those outcomes. I've had 0 patients die,
0 die.
0 patients intubated,
Yep.
and I have currently 3 patients admitted in the hospital with pneumonia. But they are not intubated, and I think they'll be fine.
And this is after treating.
Hundreds.
Could you just give me sort of the best approximation of hundreds? 500?
I think 450, 500,
All
something
right,
like that.
450 to 500. Are you treating people right now as we speak?
Yes,
Is the number declining or increasing or?
increasing. Actually, because I'm the only doctor that seems to be doing it, or one of the first, and if not the first. And so when this became public, the whole world started calling me.
So are you going beyond now treating people in Curious Joel?
Yes.
So of that 400 to 500, were they all Curious Joel, or were they people that might have come in just to visit you after they heard about it?
So a third are from outside the community.
About a third. And those are people who heard about it through word of mouth or whatever, right?
Yes.
The people that are being treated, are some of them still suffering from very difficult symptoms? I mean, is there a gradation of what you're seeing from very serious symptoms to very minor symptoms?
Yeah. Well, I don't treat people with minor symptoms unless they're extremely high risk. Can I give you my parameters?
Of course. That's what we want. Yep.
And this is to the American people. If you're young and healthy, you'll be fine.
The parameters
Correct.
are if you're young and healthy, you'll be fine.
The your immune system is strong enough. Statistically, it's been proven you will recover. You may be miserable for 2 weeks, but you will recover. You'll be fine.
Your immune system, all by itself, unaided by anything, will defeat the COVID.
Statistically, that's been the case. Yes.
Would you prescribe something for these young people to help
I,
them with that?
at this point, I don't, because the medication is not a candy. It does have side effects. So I have to have a good reason. Everything in life is a risk versus benefit analysis.
Have you
And
have you varied that with any of the young people, so that you did treat them? Have some,
yeah, well, there are young people that have illnesses.
Well, of course. So if a young person has compromises to their immune system,
Yeah, sure.
they're going to be almost in the same situation as an older person.
Exactly. That's a different. That's why I said young and healthy.
But
I define young less than 60.
pardon me?
When I say young, I mean less than 60 years old.
Okay, less than 60. And have you had any? Have you had any of those? Yeah, less than 60. No other problems. Have you had to give medicine to any of those because the symptoms were so bad?
I have. People were begging. And in clinical medicine, sometimes, you have to make exceptions.
Of
and
course,
so
right.
I have.
But you're quite convinced that in the vast majority of cases, these people are going to win the battle based on their immune system.
That's well-established fact.
Okay, so now go on the rest of the protocol.
So now you have so anyone who has shortness of breath, regardless of their situation, I'll treat, because that's a dangerous symptom.
So even for a young person, if they had shortness of breath, you're going to go right to the right to the. You're going to hit them hard. You're going to hit them hard with the hydro, with the Z-Pack, and with the zinc.
The Z-Pack is a dose schedule. I would
It's five.
prefer.
It's like five pills, right?
Right. I use a different regimen. Let's refer to it as Zithromax or azithromycin. That's more accurate.